In 28 years of treating low back pain and suffering with it myself, I've seen one pattern more than any other, and it's not a diagnosis. It's a decision patients make even without realizing. I'm Dr. Robert Moss, board certified, fellowship trained physical therapist in orthopedic manual therapy. I've spent nearly 3 decades treating patients with low back pain, both surgical and non-surgical. And the question I hear more often than any is, why does it keep coming back? Well, today I'm going to answer that honestly. Most people treat low back pain reactively. The pain flares, they rest, the pain subsides, then they go back to normal. The pain returns, they're treating the symptoms, not the cause. Think of your back like a car with a slow oil leak. Every time the warning light comes on, the light goes away. You feel fine, but the engine is still losing oil. That's what most people are doing with their back. They reset the warning light with rest, with medications, maybe a massage or chiropractic, without ever fixing what's actually wrong. If you're watching this because you're tired of being told to just rest it, hit subscribe. Every week, I break down exactly why these injuries happen and what exactly you can do to fix them so you don't have to guess anymore. The 3 real reasons it keeps coming back. Reason 1, the underlying movement problem was never addressed. The spine needs motor control and stability, not just flexibility. Generic stretches don't restore function. So, more stretching is not the answer. Reason number 2, the supporting muscles, the core, your glutes, your hips, are not doing their job. When the muscular system fails to protect the spine, the passive structures, your disc, your ligaments, your joints, they absorb forces they weren't designed for. And reason 3, fear avoidance behaviors rewire how your brain processes movement. When pain is present long enough, the nervous system becomes sensitized, meaning that even normal movement can trigger pain responses, not because the tissue is damaged, but because the system is on high alert. In my clinic, we use the 3D method. Don't ignore it, don't mask it, do something about it. Don't ignore it. Back pain is a signal. When you push through and pretend it's not happening, you're accumulating damage without correction. Don't mask it. Painkillers and passive treatments, massage, heat, ice, they have a role, but they're not treatment. They're temporary relief. If that's your whole plan, you don't have a plan. And do something about it. This means working with a qualified provider to identify your specific movement dysfunction, restore stability, and rebuild confidence in your body. Now, here's my personal story with back pain. I woke up and felt like I couldn't get out of bed. I had severe pain in my back, so bad that I couldn't breathe. Breathing was painful. I knew what was wrong, but being on this side of pain was completely different. I slowly rolled out of bed and tried to get dressed. I was embarrassed. I had to call my wife to help me. I didn't want my kids to see me this way. We were on vacation in Hawaii, celebrating our 20-year wedding anniversary. One of the most beautiful places on earth, and I could not enjoy it. I'm not sure if it was the soft bed I was sleeping on or the long plane ride, but my back was a wreck. Leading up to this vacation, I was training for a major race, but I had neglected my core training, and now I was paying the price. The next few days of vacation were grueling. I started on my stabilization exercises, found a therapist on the island to do some manual work on my back, and even had my wife stick me with acupuncture needles just to get some relief. Once I returned home, I continued with my stabilization program, added in deep tissue laser, dry needling, and had my therapist work on me so that I could return to training for my upcoming race. It wasn't the end of the world, but for those few days, it sure felt like it. So what are the exercises that I did to help me get back on the bike and out of pain? We call them the McGill Big 3, developed by researcher Dr. Stuart McGill. Modified crunch. Do 2 sets of 12 with each leg. Hold for 5 to 10 seconds. Don't hold your breath. Bird dogs. On all fours or standing. 2 sets of 12 with each leg. Hold for 5 to 10 seconds. Side planks. In sideline or in standing. Hold for 10 to 30 seconds. 5 reps on each side. Click the link below for a PDF I put together with these and a few other helpful low back exercises. If any of this sounds familiar, if you're stuck in that cycle of pain, temporary relief, and more pain, I want you to know that it doesn't have to stay that way. Subscribe to Prime Mover Health and hit the notification bell. Every week, I'm putting out evidence-based content specifically for people dealing with back pain, surgical and non-surgical, so you can regain control of your life. Move well, live well. I'll see you in the next video.